Good morning, Alex and friends. I'm Grace. Today is Sunday, May 17th, 2026, and you're listening to Alex's News. In Riverside today, expect a high of 70.6 degrees and a low of 56.9 degrees. It should be a mild and pleasant day for the region. On today's program, we are looking into the World Health Organization's declaration of a global emergency regarding an uncommon Ebola variant that currently lacks a vaccine. We are also examining why candidates running for office in California are suggesting the creation of a government-managed property insurance program to address regional needs. Beyond these major stories, we have a variety of other headlines to cover. Stay with us as we break down these important issues and much more on Alex's News. We begin with Story 1, a major global health development today, May 17, 2026. The World Health Organization has declared the Ebola outbreak in the Democratic Republic of the Congo and Uganda a public health emergency of international concern. Ethan is here with what this means.
Grace, this is a major escalation from the WHO, and it came unusually fast. Director General Dr. Tedros Adhanom Ghebreyesus announced the PHEIC today, May 17, 2026, after official confirmation of the outbreak. According to NBC News, BBC, and the Associated Press, the declaration came within 48 to 72 hours of confirmation. That makes it the fastest PHEIC designation in the history of the international health regulations.
Why did the WHO move so quickly this time?
The big reason is the strain involved. This outbreak is caused by the Bundibugyo virus, or BDBV, which is one of the rarer Ebola variants. It has moved from remote mining regions into major urban centers and international travel hubs. The WHO says this still does not meet the criteria for a pandemic emergency, but the speed of spread is deeply concerning.
Give us the current picture. How widespread is this outbreak right now?
As of mid-May 2026, there are approximately 336 suspected cases and 88 deaths. Most of those reports are coming from Ituri province in northeastern DRC. The main health zones affected are Bunia, Rwampara, and Mongwalu. BBC and WHO situation reports say those areas remain the center of the outbreak, but they're no longer the only concern.
Where else has the virus shown up?
In the Democratic Republic of the Congo, the virus has now reached Goma, which is a major humanitarian hub. That matters because Goma is also currently influenced by M23 rebel activity, making any health response much harder. A laboratory-confirmed case was identified there today, May 17th. Officials say the patient is the wife of a victim from Bunia.
And there was also concern in Kinshasa, right?
Yes, and that got a lot of attention because Kinshasa is such a large city. A suspected case there initially tested negative. Even so, health officials are staying on high alert because of the city's massive population. With Ebola, one missed case in a dense urban area can quickly change the trajectory of an outbreak.
What do we know about the cases in Uganda?
Uganda has now confirmed that the virus crossed the border. There are 2 laboratory-confirmed cases in Kampala, and both involve people traveling from the DRC. One patient, a 59-year-old Congolese man, died at a hospital in Kampala on May 14th, which was 3 days ago. That death underscores why cross-border surveillance is now such a priority.
Frontline workers are also being hit hard in this outbreak.
They are. At least 4 deaths among healthcare workers have been reported in Ituri. That is especially dangerous because healthcare workers are the backbone of any Ebola response. When they get sick or die, communities lose both medical capacity and trust. It also raises the risk of infections spreading inside clinics and hospitals.
You mentioned the Bundibugyo virus. How is it different from other Ebola strains people may remember?
Many people remember the Zaire strain, which was the focus of major outbreaks between 2014 and 2020. The Bundibugyo strain is much rarer. It has only been reported 3 times in history, first in Uganda in 2007, then in the DRC in 2012, and now in 2026. NBC News notes that this rarity is part of the problem because the world has fewer tools ready for it.
What tools are missing?
The biggest gap is that there are currently no approved vaccines or therapeutics for this specific strain. The Ervebo vaccine was highly effective against the Zaire strain, but it offers no protection against Bundibugyo. That means health officials can't simply repeat the ring vaccination strategy used in some earlier Ebola responses. They have to rely heavily on detection, isolation, contact tracing, and experimental tools.
How deadly is this strain?
The case fatality rate ranges from 30% to 50%. Symptoms often begin with fever and muscle pain, which can look like other illnesses at first. Then the disease can progress to severe internal bleeding and organ failure. That delay between ordinary-looking symptoms and severe illness makes early detection especially difficult.
The outbreak is also happening in areas affected by conflict. How much does that complicate the response?
It complicates almost everything. NPR and The Washington Post have highlighted the challenges of working in North Kivu and Ituri, where the ongoing M23 rebel conflict affects access and security. Health workers may not be able to move freely, and communities may distrust anyone seen as connected to the government. In an Ebola response, trust is not a side issue. It's central to finding cases and stopping transmission.
So how are responders adapting in those areas?
The Africa CDC and WHO are using what they call a blind spot strategy. One part involves community relays, or RICOs, who are local, non-government affiliated individuals. They help conduct contact tracing in rebel-held neighborhoods where official teams may not be welcome or safe. That approach leans on people who already know the community and can move more naturally through it.
What about people who don't go to formal hospitals first?
That is another major concern. Many patients first seek help at informal clinics or traditional healing centers. Instead of shutting those places down, responders are mapping them with GPS tablets. They are also providing basic infection prevention and control, or IPC, training so those sites can identify risks and avoid becoming amplification points.
Mining towns create another challenge, especially Mongwalu. What's happening there?
In places like Mongwalu, traditional house-to-house tracing often does not work. The workforce is highly mobile, and people may move between mines, markets, and transit routes quickly. Health workers are setting up screening points at mine entrances and transit routes. They are using the 717 model, which is designed to detect, notify, and respond rapidly.
Let's talk about travel restrictions. The WHO is warning against border closures. Why?
According to Time and The Guardian, the WHO says border closures are counterproductive. The concern is that if formal crossings are closed, people may use informal crossings instead. That makes surveillance much harder because travelers are no longer being screened or recorded. The WHO is calling for exit screening at airports and land crossings, rather than blanket entry bans.
But not everyone agrees with that approach.
That's right. Independent experts cited by The Lancet, along with legal scholar Lawrence Gostin, have questioned whether the WHO leans too heavily toward protecting international trade and the global economy. They argue that local containment can suffer when travel and commerce remain the priority. Critics often point back to the 2014 West Africa outbreak. Delays in declaring an emergency then were blamed by some on political and economic concerns.
Is the WHO saying global spread is likely?
The WHO is not saying that right now. As of today, May 17, 2026, it says the risk of regional spread is high, but it also says the global community has tools to prevent a larger catastrophe if coordination stays strong. The key message is that isolationism and border closures could make the response weaker, not stronger.
With no approved treatment, what happens next medically?
The WHO has activated the CORE protocol. That is a standardized framework for testing experimental treatments during an outbreak. It allows researchers to gather reliable data while still responding to an emergency. That matters because desperate situations can lead to scattered, inconsistent use of experimental drugs unless there is a clear process.
What is the leading treatment candidate right now?
The leading therapeutic candidate is MBP-134AF. It is a 2-antibody pan-Ebola virus cocktail, meaning it is designed to work across multiple Ebola strains. It has shown 100% protection in animal models against multiple Ebola strains. Now it is being rolled out for randomized controlled trials in Bunia and Kampala.
Are vaccine efforts moving as well?
Yes, Oxford University, Moderna, and CEPI are collaborating to accelerate multivalent mRNA vaccines. These vaccines are meant to target Zaire, Sudan, and Bundibugyo strains. They are currently in Phase 1 trials, so they are not ready for ring vaccination campaigns yet. But their development is being fast-tracked because this outbreak has exposed a major preparedness gap.
Are there other drugs being considered?
Remdesivir is being evaluated, along with an oral drug called obeldesivir. The oral option is especially important in remote areas. Intravenous treatments require more equipment, staffing, and monitoring. An effective oral treatment could simplify logistics dramatically, though it still has to prove useful against Bundibugyo.
There's also a political backdrop to this declaration. What are analysts saying?
Some analysts say the speed of the May 17th declaration may carry political meaning. They point to the United States' formal withdrawal from the WHO in January 2026. The argument is that the agency may now be moving more aggressively to secure funding from other international donors. It may also be trying to prove its institutional relevance after a major member stepped away.
Has the DRC seen this kind of double-edged emergency declaration before?
Yes, ABC News notes that PHEIC declarations in the DRC have sometimes brought both help and complications. The 2019 Kivu Ebola declaration unlocked essential funding. But it was also criticized for diverting resources from a measles epidemic that eventually killed more people than Ebola. That history is shaping the current debate.
So health officials have to fight Ebola without weakening everything else.
Exactly. Officials are trying to contain Bundibugyo without cannibalizing other essential health services. That means keeping routine care, vaccination programs, maternal health, and other disease responses going at the same time. In fragile health systems, an Ebola response can consume staff, supplies, vehicles, and money very quickly. The goal is to surge without hollowing out the rest of the system.
What should listeners watch for in the coming days?
Watch for whether cases grow in Goma, Kampala, or any new urban center. Also watch whether the suspected case pattern changes in Kinshasa, even though the initial test was negative. Another key signal will be whether the trials for MBP-134AF can begin smoothly in Bunia and Kampala. And finally, pay attention to whether countries follow the WHO's advice on exit screening instead of border closures.
Bottom line, how serious is this moment?
It is serious, but not hopeless. The fast PHEIC declaration shows the WHO wants the world moving before the outbreak gets further ahead. The biggest challenges are the rare Bundibugyo strain, the lack of approved countermeasures, and the conflict zones where response teams must work carefully. If coordination holds, officials believe a larger catastrophe can still be prevented.
Ethan, thank you for walking us through it.
Thank you, Grace.
Welcome back. Our next story takes us to one of the biggest policy fights brewing on the West Coast right now. California's property insurance market has been teetering for years, and voters are about to weigh in on a pretty radical set of solutions. Here to walk us through it is our reporter, Chloe. Good morning, Chloe.
Good morning, Grace. Yeah, this is a really consequential moment for California. The June 2nd, 2026 primary, just a couple of weeks from today, will pick a new insurance commissioner. And the candidates are floating ideas that would have been unthinkable just 5 years ago. We're talking about the state itself becoming an insurer, not just a regulator.
So how did California get to this point? What pushed things from a regulatory issue into a full-blown crisis?
A lot of it traces back to the January 2025 wildfires, the Palisades and Eaton fires. Reporting from the Cali Reporter and Cal Matters pegs insured losses at somewhere between $30 and $40 billion. Major carriers like State Farm and Allstate had already been pulling back. And after those fires, the state's insurer of last resort, the FAIR Plan, became the primary insurer for nearly 10% of homes. Insurance Newsnet describes the FAIR Plan's finances as, quote, precarious, end quote.
Wow. And I understand the FAIR Plan is now asking for a big rate hike of its own?
That's right. According to Insurance Newsnet, the plan levied a $1 billion assessment on member insurers in early 2025 just to pay claims. It's now seeking a 35.8% rate hike to stay solvent. And by late 2025, total exposure for the FAIR Plan had reached $724 billion. That's a 230% jump since 2022.
Those numbers are staggering. Let's talk about the candidates. Who's leading the pack heading into next month's primary?
There are 11 candidates in this field, but a few are really driving the debate. According to CBS News, State Senator Ben Allen is currently the frontrunner in both polling and fundraising. He led the February 2026 Democratic Endorsing Conference with 41.69% of the vote. Allen is looking at state-backed reinsurance models, sort of like the FDIC does for banks, but his platform leans more toward consumer advocacy and fire-hardening loans for homeowners.
Okay, so Allen is the more measured option. Who's pushing the bigger overhaul?
The boldest proposal comes from Jane Kim, a Democrat and former San Francisco supervisor. She's a frontrunner in the Berkeley IGS polls. Kim is calling for what she labels, quote, disaster insurance for all, end quote. It's essentially a publicly run, single-payer system for natural disasters. She's modeling it on the New Zealand Earthquake Commission and France's CCR.
And how would that actually work for a homeowner?
The state would provide the first layer of coverage for all wildfire and flood damage, funded by a portion of current premiums. Kim told CalMatters that the state would, quote, steward, end quote, those dollars and reinvest in prevention rather than corporate profits. The goal is to socialize the risk so coverage is guaranteed no matter where you live. But the California Department of Finance has warned that this could expose the state to billions in liabilities, potentially requiring general fund bailouts if the new fund goes insolvent.
That's a real concern. What's the Republican response look like?
The most prominent Republican plan comes from Merritt Farron. He's an attorney and former tech executive who actually lost his own home in a wildfire. Farron is proposing something called Cal Reinsure, modeled after the Florida Hurricane Catastrophe Fund. It would act as a backstop for catastrophic losses, funded by a fee on insurance policies, and would issue state-backed municipal bonds to pay claims after large fire events.
And his argument is that by absorbing the worst-case risk, private insurers come back.
Exactly. Farron argues that if the state takes on the extreme tail risk, private companies will return and the FAIR Plan becomes obsolete. But economists at UC Berkeley caution that this carries serious debt risk. If megafires happen frequently, taxpayers could be stuck servicing long-term debt for decades. So both Kim and Farron are essentially asking Californians to accept new state liabilities, just structured differently.
Are there any other candidates worth knowing about before we move on?
Yes, a few. Lalo Vargas of the Peace and Freedom Party wants a total state takeover, replacing the 10 largest insurers with a single public entity. On the Republican side, Stacey Korsgaden is the GOP-endorsed candidate and a licensed agent. She's pushing free market reforms and a new business division within the department to bring private capital back. And Carl DeMeo, also a Republican, proposes a 7% cap on rate increases, with the state covering the difference through general fund revenues.
There's a real ideological spread there. Let me ask about the underlying debate. Did the private market just collapse on its own? Or did California's own rules push it over the edge?
That's the central tension in this campaign. The Los Angeles Times and CalMatters report that many economists blame Proposition 103, which passed back in 1988. For decades, that law prohibited insurers from using forward-looking catastrophe modeling, and it banned them from passing reinsurance costs on to policyholders. So as global reinsurance rates spiked, California essentially became uninvestable for major carriers, leading to the mass withdrawals in 2023 and 2024.
So this was a slow-motion crisis that the fires just brought to a head?
Pretty much. The current commissioner, Ricardo Lara, did begin rolling out something called the Sustainable Insurance Strategy, or SIS, in late 2024 to address these structural issues. But then the January 2025 fires hit, and that became a political break-glass moment. Candidates like Kim and Farron are now arguing that Lara's reforms are, quote, too little, too late, end quote.
What about the warnings from other states that have tried this? Florida comes to mind.
That's a huge part of the conversation. Reports from NPR and research out of the University of Chicago point to Florida's citizens' property insurance as a cautionary tale. State-backed pools tend to create what economists call moral hazard. By artificially suppressing the true cost of risk, Florida's subsidies actually led to a quadrupling of coastal populations, even as hurricane risks grew. People built where they probably shouldn't have because the state made it affordable.
And there's a fairness question too, isn't there, about who's actually paying?
A really important one. Data from the 2025 Palisades fire suggests state-run pools often result in a regressive wealth transfer. Because the most expensive properties to insure are high-value homes in wealthy enclaves, state-backed models can mean that urban renters and Central Valley homeowners are effectively subsidizing insurance for wealthy homeowners in the wildland-urban interface. That's a tough sell politically, and critics of Kim and Farron are leaning into it hard.
Now, you mentioned the sustainable insurance strategy. Is there any evidence the current approach is actually working?
There is, and it's complicating the market failure narrative. The California Department of Insurance reports that since insurers were allowed to use catastrophe modeling, Mercury Insurance has committed to writing 38,000 new policies in high-risk zones. CSAA, which is AAA, has already written 18,300 more policies in high-hazard areas than required. And Farmers and Travelers have both announced expansion plans.
So the private market is showing some signs of life. What about the big holdouts?
State Farm and Allstate remain on the sidelines. Allstate is waiting for a 34% rate approval before resuming new business. And State Farm is tangled up in enforcement actions over how it handled the 2025 wildfire claims. So while smaller and mid-size carriers are coming back, the two biggest names are still in limbo, and that shapes how voters perceive whether the SIS is really succeeding.
So when Californians head to the polls on June 2nd, what's really at stake?
It's a fundamental question about who carries California's risk going forward. Voters can stick with the deregulation path under SIS and bet that private insurers fully return, or they can pivot to a state-run, single-payer, or backstop model, like what Kim or Farron are proposing. Essentially, the choice is whether California's wildfire risk is managed by global capital markets or socialized across the state's tax base. And whichever way it breaks, the consequences will ripple for decades.
A really clarifying way to put it. Chloe, thank you so much for breaking this down for us this morning.
My pleasure, Grace.
Here are some other headlines. Thousands of activists and voters gathered in Montgomery, Alabama this past Saturday, May 16, 2026, for the All Roads Lead to the South rally. In the birthplace of the civil rights movement, a coalition of over 90 organizations, including Black Voters Matter and the NAACP, stood their ground to defend Black political representation. The demonstration follows the Calais ruling, a Supreme Court decision that critics say has redrawn the lines of democracy by weakening the Voting Rights Act. High-profile speakers, including Senator Cory Booker and Representatives Terry Sewell and Alexandria Ocasio-Cortez, characterized the redistricting as a coordinated attack on majority Black districts. With primary elections in Alabama and Georgia just days away on May 19th, this mobilization is a primary concern for those looking to protect the political landscape for the next decade. In the nation's forests, the debate over fire management is really heating up. Federal wildfire mitigation grants, totaling approximately $200 million, are currently stalled. The Department of Agriculture has introduced new America First requirements that mandate specific immigration and diversity hiring criteria, leaving 22 states and 2 tribes in a bit of a thicket. 20 states and the District of Columbia have filed a lawsuit, claiming these terms are coercive and unrelated to fire management. While the Forest Service has shifted to a full suppression strategy, local managers warn that the funding freeze is fanning the flames of risk during a season of record-breaking heat and drought. Meanwhile, the Department of Homeland Security and FEMA have only begun releasing disaster funds after being sparked into action by federal court orders. Switching to the power grid, officials in at least 6 states, including New Jersey, Maryland, and Arizona, are conducting a shocking investigation into utility company profits. As residential bills outpace inflation, records show that profits for 110 major investor-owned utilities surged from $39 billion in 2021 to over $52 billion in 2024. Arizona Attorney General Chris Mays is challenging a 14% rate hike, while Pennsylvania Governor Josh Shapiro is calling for an end to prioritizing corporate profitability. This current situation is further complicated by the artificial intelligence boom, as new data centers put a massive charge on grid demand. In New Jersey, Governor Mikey Sherrill has declared a state of emergency to force a change in the power play. Across the Pacific, Hawaii is weathering its most severe flooding in over 20 years. Back-to-back Kona low storms have caused $50 million in damage, muddying the waters for approximately 2,000 farms. On Oahu's North Shore, the harvest of staples like tomatoes, leafy greens, and lemongrass has been washed away, with some vendors seeing their output drop to just 25% of normal levels. Agricultural official Sharon Hurd is working to keep small-scale farmers from digging their own graves in the industry, while Governor Josh Green is seeking a federal disaster declaration to help those currently stuck in the mud without insurance. Finally, Amazon CEO Andy Jassy is in the hot seat following a class action lawsuit filed in federal court in Seattle. Consumers allege the e-commerce giant delivered a raw deal by deliberately refraining from seeking billions of dollars in tariff refunds to curry favor with the administration. While a recent Supreme Court ruling invalidated parts of the tariff regime, plaintiffs argue Amazon passed those illegal costs to customers through higher prices and then sat on the potential refunds. With a $175 billion refund pool available through U.S. Customs, this legal challenge could be a package deal that changes corporate governance before temporary tariffs expire in July 2026. That's all we have for now. Today's episode was made by Alexander King, with Claude Opus 4.6, Gemini Pro 3.1, Gemini Flash 3, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.